My name is Shtern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. My gratitude to Jill Harvey and Zane Krut for their partnership in presenting this joint 5th annual prostate cancer awareness event hosted by AdMeTech and Mystic Valley. The focus of my talk is on the AdMeTech Foundation's prostate cancer program created to lead advances in screening, diagnosis, and treatment, to bring them to Massachusetts men and eliminate health disparities. It's a great pleasure for me to introduce Dr. Mitchell Sokolov, professor and chair of the Department of Urology at University of Massachusetts School of Medicine and prostate cancer survivor. He will review recent advances in screening and diagnosis of prostate cancer. We have been working closely with Dr. Sokolov for more than a decade to increase prostate cancer awareness and bring cutting-edge advances in patient care to Black men.
Good morning. I'm Dr. Mitchell Sokolov. I am professor and chair of urology at UMass Chan Medical School and UMass Memorial Medical Center. It is a pleasure to be presenting today. In the next several minutes, I hope to provide some insight into emerging advances in prostate cancer screening and diagnosis. I come from the perspective of not only being an expert in the surgical management of prostate cancer, but also a prostate cancer survivor. The key to adequately diagnosing and treating prostate cancer begins with appropriate and accessible screening. The correct population needs to be targeted, and a panel of screening tests needs to be available to best determine who is at risk for prostate cancer and who needs treatment. Precision diagnostics combines the most effective combination of laboratory, radiologic, and pathologic tests. Traditionally, and currently, screening starts with PSA blood tests and a prostate exam. Any abnormalities are then followed with a biopsy of the prostate to establish if prostate cancer is present, and, if so, its aggressiveness. Today we have multiple technologies that can improve upon traditional screening techniques. This includes artificial intelligence enhanced biomarker analysis, liquid biopsy techniques, and advanced imaging. Optimizing prostate cancer screening for high-risk population involves a targeted, personalized approach to improve outcomes while minimizing harm. Key strategies include identifying high-risk populations, which include African, Afro-Caribbean, and African American men, those with a family history of prostate cancer, and men who might have BRCA1 and 2 mutations or other genetic factors. Early and tailored screening at an earlier age and with more frequent screenings as necessary, and genetic testing should be incorporated. Use of advanced screening methods including biomarkers and imaging to enhance the accuracy of prostate cancer detection, to reduce unnecessary biopsies, and to improve detection of clinically significant cancers. Personalized follow-up for men with abnormal screening tests, and monitoring and adjusting based on evolving evidence are also key factors. And, perhaps most importantly, since many of the high-risk men represent underserved populations, making sure there is a focus on education, awareness, and access. By focusing on these strategies, prostate cancer screening can be more effective, particularly for those at higher risk, while we minimize harm from unnecessary procedures or overtreatment. Collectively, the following technologies represent a shift towards more precise, personalized, and non-invasive methods for prostate cancer screening and detection, with the potential to significantly improve patient outcomes. Imaging. Multiparametric MRI has become instrumental in identifying and characterizing prostate cancer. Studies have demonstrated time and time again that MRI-guided targeted biopsies can enhance the detection of significant prostate cancer and reduce the diagnosis of insignificant disease. PSMA PET-CT scans utilize radioactive tracers to identify cancerous cells, offering precise insights into the presence and spread of cancer. It was originally indicated for staging of known disease, yet PSMA PET is now being used earlier in the screening and diagnostic arenas. Artificial intelligence is being applied in many areas of prostate cancer screening and diagnosis, and it is revolutionizing the field. AI can be used to analyze large data sets to assess digital images of prostate tissue, and this can aid in predicting cancer behavior and treatment responses. In radionomics, AI can extract quantitative features from imaging studies to predict disease characteristics and outcomes. Histopathological examination remains the gold standard for confirming prostate cancer, but it is a resource-intensive and can be subject to variability. AI has made significant strides in this area, with algorithms being developed to assist pathologists in analyzing prostate tissue samples more effectively and more efficiently. Lastly, liquid biopsy involves identifying and sequencing DNA fragments shed from tumors into the bloodstream, and it can provide insights into genetic mutations and tumor dynamics. AI is being leveraged to discover and validate biomarkers for prostate cancer diagnosis and prognosis, and liquid biopsy, which analyzes blood samples for these genetic and molecular markers, is an emerging area where AI plays a critical role. In summary, integrating advanced imaging techniques, biomarker analyses, circulating tumor DNA sequencing, and artificial intelligence holds promise for enhancing prostate cancer screening and diagnosis. These innovations aim to improve early detection, to tailor personalized treatments, and ultimately to enhance patient outcomes. Continued education and access initiatives continue to be crucial, and your continued support is needed to ensure that the men of Massachusetts have access to the best-in-class diagnostics and therapeutics for prostate cancer. Once again, thank you for allowing me to participate today.
AdMeTech Foundation's prostate cancer program created a Massachusetts model of national and global leadership in public awareness, medical education, research, and health equity. I'd like to express my gratitude to members of the Mystic Valley delegation to the State House who made this program, including today's event, possible. AdMeTech is working in cooperation with multiple organizations, including but not limited to American Cancer Society New England chapter, leading clinical experts, and multiple branches of the NAACP and Latino Health Insurance Program located across the state. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. Since 2019, we reached well over 71,000 people. The centerpiece of AdMeTech's medical education is annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical field to review the best emerging clinical practices and research needs and priorities. There is not a corner of the world that has not been represented at this event. The latest 9th annual conference took place only in September 2025, several weeks ago. Our summit demonstrated that early detection saves lives and eliminates health disparities. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread outside of the prostate to other organs, only 28% of men remain alive at the same time. Early detection is particularly important for high-risk individuals, including any men with family history of prostate cancer or Black men who are twice as likely to die as white men. In prostate cancer, screening with blood test called PSA is the best tool we have for prevention and early detection, critical for saving lives and reducing health disparities. If we look at the reduction of mortality per year, PSA blood test is the most successful screening tool we have had in the history of cancer. It is important for men to take charge of prostate health. To do that, it's important to know your risk factors, such as Black heritage, family history of prostate cancer, particularly when your brother or father had this disease, and increasing age, 50 and older. You can assure early detection during annual visit. Ask your doctor to discuss if PSA blood test and digital rectal exam are right for you. You need to talk to your doctor starting at the age of 40 if you have risk factors I just described, or at the age of 45 if you do not have these risk factors. Before screening, it is important to avoid exercise or sex, which may impact your testing results for at least 2 days. After screening, you need to ask your doctor if your test is normal or if you need to see a prostate cancer expert for further evaluation. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care for all. More recently, experts from Beth Israel Lahey joined us. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older is welcome to participate. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion in person or virtual visits. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the prostate cancer equity program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer longer term, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined process of patient referral and care, reflecting how doctors involved in this program would like to take care of our families and friends. This process consists of several components. First, AdMeTech Foundation's team collects basic information and match individual patients' needs with the appropriate state's experts for clinical care. Second, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, financial, and insurance assistance if needed. Third, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as, for example, additional testing or treatment. I'd like to provide a few recent examples of how PCE Resource Project has been making a difference. In December 2024, Martha's Vineyard NAACP asked us to help an older Black man who expressed a lot of confusion and concerns about his care. AdMeTech staff contacted Dr. David Einstein at Beth Israel Lehi, who agreed to provide a second opinion. In February 2025, this man and his wife had a visit with Dr. Einstein, who provided a clinical consultation and contacted the original clinical care team to ensure a coordinated approach. In March 2025, a patient and his wife described that as a direct result of Dr. Einstein's consultation, they understood their situation for the first time and became clear about the next steps. The second example involves George Brickhouse, who in December 2022 took part in the virtual meeting of the PCE resource organized by Steve Bernard, immediate past president of Brockton and ACP. During that meeting, George expressed the lack of trust in his care and difficulties in scheduling prostate MRI recommended by his doctor. We got concerned, and after the meeting contacted Steve and asked him to explore with George if he would be interested in our PCE resource. In early 2023, George contacted us and we suggested for him to consult with Dr. Kwok Ding Trink of Mass General Brigham, who can ensure the best of last care, including high-quality MRI. George has been so happy with his care that he became an advocate for our prostate cancer equity resource. In late 2024, Dr. Trink moved to Pennsylvania due to academic promotion. In March 2025, per George's request, we referred him to Dr. Adam Feldman, another leading clinical expert at Mass General Brigham and our partner at that clinical institution. Emma Coyer serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, and other members of the AdMeTech Foundation's team. We serve as your individual patient care advocates. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, Beth Israel, and other clinical partners to expedite medical visits and address any needs you may have. Together with clinical experts, we empower each man to make informed choices in patient care that are right for him before and after screening, biopsy, and treatment. If you have any questions or need assistance, please contact Emma by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.